And now for Ken Mastris, who couldn't come, unfortunately, because he had a family problem, it was very, very nice that Owen Sharp has very spontaneously agreed to give the patient's perspective. He's from the UK, and he's now the CEO for Movember, and also he was the CEO of Prostate Cancer UK before that, and he's really perfect to speak about it. And you're getting some chocolate because you have been so spontaneous. Thank you very much, Owen.
Thank you. There you go. So I was asked at late notice to give the patient's perspective on the days. Well, the first thought that I had from that is that's a pretty shonky way to give somebody a diagnosis. I am not a patient. I need to just state that from the outset. The second thought that I had is actually, I don't think I should be giving a patient perspective. I think I should be giving a perspective on behalf of men, because most men who are diagnosed with prostate cancer would much prefer to be defined as men as opposed to being defined as patients. Prostate cancer only happens to men. I hope that wasn't a surprise to any of you in the audience as clinicians. But really, most importantly within that, it's a disease that hits at the very heart of masculinity. And I think if we can all think about men with prostate cancer as men as opposed to patients, then we're probably going a long way forward. My disclosures, I see that's what you all do at these sort of things, so I thought I'd have a go. I am very, very proud, very honoured and very humbled to be standing here on behalf of over more than 5 million Mo Bros and Mo Sisters who over the past 13 years have raised the incredible sum of money that you see there. I think it's really, really important that I recognise that fact, and that's the basis on which I speak. I should also call out at this point the fact that many of you are sitting here and a fairly big financial contribution to the past 3 days was made by Mo Bros and Mo Sisters in Switzerland. So I think it's really important that we call out to them and say thank you very much for all of your efforts to help pay for this fantastic event. As you can also see, there is a fairly significant sum of money that has been put into the funding so far on behalf of prostate cancer, and that is a figure that doesn't include the money that we've raised last year and the money that we still intend to raise. So that is obviously a pretty substantial disclosure that I have to declare as well. So in the last couple of minutes, I thought I'd just give you some reflections on behalf of men for what I've been lucky enough to hear from all of you over the past few days. So I've been thinking about this as we've been going along, and there's a few reflections. My first reflection, having listened to all of you speaking over the last couple of days, is that there's some really exciting stuff going on, but if I was a man sitting in the audience, I'd probably be quite scared as well, because there are an awful lot of very important but pretty conflicting debates going on at the moment. And I think Ros summed it up very well yesterday with the quote that you see there. So I think the first thing I would say on behalf of men is please don't stop searching for the consensus that you are searching for, because it really is very important. And as you will all know as clinicians, it's scary enough when you've got this disease. It's doubly scary when the various forms of diagnosis and future are facing you. So we really do need some clear answers. So the next thing that I'd like to offer to you is a couple of challenges as we go forward. And I've set these on the basis that we will be at this conference in 2019. So what do I think that men would like to see from you as you go forward for the next 2 years? I think the first thing that I would expect a lot of men would say to you is please think about this disease in terms of outcomes, both from the perspective of survival and quality of life. It is not just about the number of years that you add to my life as a man with advanced prostate cancer, it's also about the quality of that life. Please don't forget that. I think it's really, really important that we not only look at the physical health, but we also look at the mental health. And one of my other observations of listening to the past 2 days is we've heard very little about the mental health of men with prostate cancer, and I do think we need to do more about that. So, on basis of a shameless plug, and from the session that we heard this morning, which I think was fantastic, I do think there's a great deal of work where we can get the very concept of outcomes and the experience of men into the heart of what we're doing. What that will mean is that we will really know what excellence looks like, and we'll know what excellence looks like both from a clinical outcomes perspective, but also from the perspective of men. We can understand the variation in treatment because, as you all know, the variation across sectors, in countries, is huge, and we need to be reducing that. And we also need to know what works against all measures and against all perspectives. So I hope in 2019 that we will have in place patient-centred tools and resources that really do enable men to make better informed treatments and to really be having discussions and decisions. And I think a measure of that success between now and 2 years' time is that men will be more empowered and more informed. And that tool will be in place. And one of my requests of all of you over the next 2 years is that you get on board with the work to do that, but also that you champion them. Because your relationship with men who have prostate cancer and your ability to champion the tools that will actually allow them to be more empowered is huge. You are the most important and powerful marketing force in terms of getting men more involved in their care. So please use that opportunity. I'd also like to think that actually the learnings from that will be embedded in future research studies and proposals that we're putting forward, so that we will be actually accelerating our interventions, the knowledge of those interventions, and that we will be putting in place best practice that really is getting to men and their families. So finally, I think it's really important to think that in 2 years' time, we will actually be translating the knowledge from what we've learnt over the past few days and what you'll be learning across the time. Because in the end, and I think as we heard in the sessions this morning, incredibly powerfully, the experience of men is based, or the majority of men, is not the experience that any of us in this room will have. Most men who get prostate cancer will not be well educated, they will not be well informed, and they will not be living in the places where they get the access to the better treatment. So our ability to take the knowledge from events like this, with the creme de la creme of the research community and the clinical community, and get it as far out there and as wide out there, is probably the greatest and most exciting challenge that we face. So very finally, I just want to say to you, on behalf of a lot of men that have advanced prostate cancer, that will have advanced prostate cancer, a huge and a massive thank you for all that you're doing. The last few days have been really, really exciting, challenging, and I think something that gives a huge cause for optimism, because the energy and the passion that I've seen in the last couple of days has really, really enthused me on behalf of men out there. So I'd like to say a huge thank you for all you have done, but more importantly, all you will do in the next 2 years. Thank you.
So thank you very much. I think that was a very, very strong ending, and I hope you have all a very nice evening. And we want exactly what you're saying, so distribute everything you heard, and I think that's really important. Thank you.